I'm going to share screen and can you see my slide?
Yes,
Yeah.
yes, Ganga, we can see you. You can make
Yes.
it. Yeah.
So thank you very much for recapping the past 10 years. And 10 years now looking back seems like a long time. And thankfully, we've been quite active. Then we realized that when 2020, we had really looked forward to a beautiful meeting in Bali, where literally hundreds of people from around the world really signed up. And then what happened? COVID struck. And COVID struck, we were really stranded because we didn't know what to do with all the messaging of ophthalmic trauma that we wanted. And all countries in the world steadily and serially started going into lockdown. But there was still a hunger and demand for all the knowledge that we were sharing over a period of time with experts like you traveling across the world, coming and sharing information. To me, the inspiration for doing all this has been Professor Ferenc Kuhn. I still call him the founding father of modern ophthalmic trauma management. He's devised a lot of things which the rest of the world has really adopted. Some parts of the world still is waiting to adopt. And what I like about him is always a patient-centric approach with novel concepts, and he has an interesting mix of conventional and unconventional techniques. And every time I meet with management or senior leadership anywhere, I always sometimes defy conventional wisdom because that's what you want to put the patient first and deliver the best possible outcome. So we have been conducting various meetings and we switched gears from the COVID lockdown periods, like Professor Natarajan was talking, with collaboration with Ocular Trauma Society, organizing the first ever APOTS virtual webinar, followed by the second meeting where we ended up having 6 different courses at the World Ophthalmology Congress. We've been working very closely with Professor Jan Talma, trying to really strike a relationship with our nations in the African continent, trying to start African Society of Ophthalmic Trauma, and we had wet labs design. Unfortunately, we had to go virtual, but it was quite successful. And then we went on to the third webinar, which is organized by the GANGADHARA Institute in Cochin, in India, where we are all now starting to learn how to do webinars and virtual conferences. And that interest really led to the 2-day first ever ophthalmic trauma webinar that we did in September, where we literally had speakers from all around the world. And interestingly enough, if you look over here, that's when we came up with the very first Global Perspectives Conference. That's when we really heard from different societies in different countries in the world, each one facing their own challenges and how they're willing to work together. Another aspect of this particular webinar was the first time we started involving allied health, ocularistry, low vision, prevention, led by Annette Hoskin from Perth, Australia. And those 2 things were unique and really brought a lot of attention to ophthalmic trauma, not just in diagnosis and management by us, but prevention of ophthalmic trauma and rehabilitation as well. And Academy also went virtual, so we had a nice course. This is the 3rd or 4th year in running where we're doing an ophthalmic trauma course at the American Academy of Ophthalmology, and we'll be submitting one more course for this year. And APOTS has been involved in various other societies organizing various webinars. So this webinar was planned with the intent that 2021 will be a post-pandemic year, and we really wanted to learn lessons from different continents. We know that a lot of patients delayed healthcare, or because of the restrictions, there's a lot of suboptimal care, but creativity amongst the surgeons and hospitals have taught us how to overcome patient and patient care handles. And that's where global collaborations comes in, and I'm a strong believer of learning from each other. None of us are perfect. And that is what led to this particular webinar, and really thank all these esteemed speakers that were invited from around the world. Professor Huayan from China, Ginny Giampoli from EBRS, Professor Jan Talma from South Africa, Hugo Ocampo from Colombia representing the South American continent, and the young Gary Recault from the United States. We're also pleased to have Dr. Victor sharing with us today a novel implant in the management of traumatic glaucoma. And finally, and most importantly, we are really, really honored to have Professor Tamara Fountain from Chicago waking up at 6 o'clock in the morning to give us the 10th anniversary oration on trauma, triage, and management. Welcome you all. And I'd like to say a big thank to our sponsor, AOI, and the Paul Glaucoma implant, which has been revolutionizing everything. Finally, we're going to end up with a little discussion by Professor Ferenc Kuhn and Jose Dolma, Kendrick, and Rupesh Agarwal. Dr. Azad is unable to be here, but I welcome you all to this webinar. Thank you very much.